Welcome to We Are the Remedy, where each week we highlight a person from the community who embodies the idea of people helping people. Man, this is amazing.
How great is this? And you can feel almost, because you're in a completely diverse world now, you're outside of you're in virtual, but your serenity levels go up and your cortisol levels go down. You just,
Oh my God.
yeah, this is great. And it's great for therapy and just talking to children and PTSD vets. Hi, everybody. This is Mike Pritchard for We Are the Remedy with my good buddy, former student, now my professor of all things technology, and my good friend, Erin Bogdanski, creator of Thera VR. Amazing, patented, researched VR for helping with therapy with children and folks who have high trauma or stressors. This is such a great thing, and I just want to take this off now, and I want to introduce Erin, and let me just quickly, briefly, just say about her that I met her many years ago working at Yountville with veterans, teaching comedy writing with Sergeant Tom Bird, combat vet, Vietnam. Winner of the Peabody Award and the Emmy for his beautiful HBO movie called Letters Home from Vietnam. And we met Erin there where she was working with us and doing therapy, comedy, laughter, joy, fun. And we just had so much fun with all these multiple tour guys coming back. When I met her, I was so enthralled that she was great with the guys with the trauma, helping them, and then also as well with the staff, because she's a genius therapist and an amazing spirit, and I'm honored to have her on the show today so she can introduce a little bit of her journey in America. She is a Canadian expat, and we're waiting to hear about her citizenship here because of the brilliant entrepreneurship. Hello, everybody. So, and my good friend Trevor Henley, who I have known since he was a kid. He was on my show called Saving Our Schools from Hate and Violence after Columbine. He was a remarkable and enlightened spirit then, and only continued on that path of wisdom. And I'm honored to have him always as a partner, and We Are the Remedy because of our attachment to Rotary International and all the folks we're trying to reach out to help us get more medicine out for the world in a heartfelt way that benefits kids and people who are suffering. So, Erin, could you tell us a little bit about yourself and just tell us everything about how your journey was and, where you went to college and school and what your therapy degrees are in and what you've been doing even now, lately, even at Stanford?
I don't know where to start. I'm one of those people that has many lives.
Right, yeah.
So I actually first came to the United States in 1999. My first job was in Los Angeles, and I left. I was born on Vancouver Island, Victoria, BC.
Beautiful area, yeah.
And
Bouchard Gardens, right?
Yeah. That was one of my mom's favorite places.
Yeah, beautiful.
So my first job, my first job was on the ships, and I was at sea for 5 years, and I was crew, and actually we all had to be trained under the U.S. Coast Guard, so they used to call us shippies, and but that was my first advent into the United States, and 9/11 happened, and that's when I returned back to Canada briefly, and then I returned back to the United States to go to school, and so I studied. I actually have 5 degrees. I had
Wow.
I studied a bachelor's of music, and then I got a degree in recording arts and broadcasting. So I was really heavily focused on my music career, and then I was stationed in New York for 2 years, and my dream was to go to Juilliard, and so I actually auditioned for Juilliard when I was really young. And then in my 3rd degree, I actually got a bachelor's in education, and I was a teacher for a bit. So I taught English as a second language. And actually, I was teaching at an American college first abroad, and I actually lived in Spain as a teacher for a couple years, and then I returned back to the United States. And
What a journey, though.
Yeah,
I mean,
well
really,
traveled.
yeah, well traveled and well enlightened. Go ahead.
well, working for the ships, I worked in 15 different countries before
Wow.
the age of 26,
Wow.
which was pretty crazy.
Right.
And then when I came back, my mom, God bless her, she kind of really pushed me to get a higher education, and she really wanted me to take that knowledge that I accrued as like being exposed to so many countries and having all these different experiences. So I actually went into law, and so I went to the University of British Columbia for pre-law and political science.
Wow.
And that led me to a job with the Consular General of Canada in Seattle, Washington. And that's why I have a 206 number, because actually I lived in Seattle for many years.
Wow.
And when I was there, I was working in foreign affairs, so I have a really strong tie to the political, like a lot of the
And diplomacy and
yeah, and
wow.
especially understanding, for other immigrants that are
Yes.
coming to the United States and that whole process. And then from there, my mom got ovarian cancer in 2008, and I actually left the United States to take care of her, and that was a really hard part in my life.
Sure. But from that compassion and the suffering, you learned so much about why it was important to do the work that you presently do.
Well, it led me to pivot into healthcare.
Right.
So when she was, and that's how I
Yeah.
I became a health psychologist. When she was sick, in Canada, the healthcare system's awful. First of all, it's absolutely terrible. It's a socialized standard of care, and there wasn't even enough sessions for chemo. Like, she would be on these waiting lists for months and months and months. And I put her into an alternative holistic center. And actually, thanks to the American healthcare system, had much better services for treating cancer patients. Anyway, we tried to get her into those programs, like Johns Hopkins and the Fred Hutchinson Center for Cancer. But anyway, I got really immersed into her treatment. And I actually, when I was taking care of her, I'd be hanging with not just the doctors, but the psychologists.
What were you learning, Erin? What were you learning?
A lot of it was mindfulness meditation.
Right.
And also a lot of what my research is focused on is epigenetic treatment, meaning that you can actually change your dormant DNA into fighting disease and preventing disease. And so I just started getting really into the science behind it. And so I took a break from law, even though like I'm a fighting spirit. Like I'm like
Seeking justice for all.
Yeah, I'm a true advocate.
Yeah, you are.
But then I pivoted and went into healthcare, and so I ended up studying health psychology at Santa Clara University. And through my ties at Santa Clara, I was able to write my graduate thesis at Stanford, and that's how I developed all my relationships with the
What was your
department.
graduate thesis, if you don't mind my asking? What was it about? Just basically.
Well, I wrote several papers. I did several trials. One of them was
Right.
at Yountville with you.
Yeah.
But my major thesis was for graduation was on epigenetic treatment combined, like how that's applied for preventative prevention for mental illness. So it's a health psychology
Yeah.
a concept that through different health behaviors that we can do, we can actually reverse the impact of developing certain mental illnesses, and that's also comorbid with coping with certain medical issues like diabetes or post-addiction there's a whole bunch of
Well,
different
look at
cases.
your background. You're doing music therapy. I mean, you're a great skilled musician. I've heard you play piano. You're a master. You're well traveled. You've traveled internationally. You've worked in political science and understanding the systems, and now you are in a need of the support that Trevor and I, when we watched this and we filmed this stuff we filmed for you, we were like, wow, this is really epically important technology and the use of technology as telemedicine.
Yeah, and that's kind of like the next part of the chapter is, as a clinician working in all of the mental health care system
Right.
in the United States is so bad. It is so flawed. And that's why you see, like, even just post COVID-19,
Yeah, there's a real need for it now, right? Like
there's
never before.
it's made such an awareness to the nation that the system of care is so bad. That's why you have 50% increase in teenage suicide alone in Northern California, just with girls.
Right.
That was Dr. Christine Garcia from Edgewood was on the radio 2 days ago, and those numbers are astronomical.
Right.
And you know where it's happening? It's only in the U.S. That the rates of suicide are so high.
What do you attribute that to, Erin? You're
Really poor policies in the mental health industry. They're focusing too much on these old standards that are outdated, and they're not turning to innovation. And that's why I created Thera actually in memory of my mom.
right.
Because I could relate to her experience in hospice, being alone and going through all that pain. And when I created Thera, it was like testing the neurological effects of actually being with somebody, but then having the neurological experience of feeling that you have an avatar body. And
Right.
in neurology, they call this like phantom limbing, like when you have an amputee or something like this. When you go into Thera and you actually embody an avatar, and the technology is, like, if you're talking about the product, this is called 6 Degrees of Freedom. If you're struggling with a certain condition, either it's pain or even major depression or anxiety, having this experience of feeling that you have a body where you're moving and you're climbing like a waterfall, or you're roaming through this desert that has this beautiful sunset, there's a neurological change that happens because you're completely present. And you don't get that in a regular telemedicine experience where it's just Zooming.
Yeah. I got
So
it.
that's the neurological benefit. But on top of that, therapy is about having somebody there that is completely present
For you.
and making you feel safe.
Right.
That's what therapy is. When you go and get therapy in the hospital, you don't get that. You get 20 minutes of case management. In private practice, which is actually a scarcity right now because everyone's so booked.
The demand.
The
Demand
demand.
is up, yeah.
And there's no in-person visits, right? Telemedicine is the solution to that. And even yesterday, after my meetings with Oshner, with air visits, the numbers are so high in the demand for just general counseling, but people can't leave their homes. They can't just go to a private practice anymore. So what we can do is provide the technology to their homes, and on top of that, combine that with everything else, all of the rest of the telemedicine tools that they need in place. And that's called home hospitalization, meaning you can reduce the cost or the burden of the cost to the American healthcare system by using innovation to not just improve the patient outcomes, but to reduce the cost and the burden on the system. Because the major problem with the mental health care system is all that money, 235 billion
Right.
in the mental health care industry, it's squandered. Where does it go? It goes to the insurance companies, and they control who gets treatment. And they also control what's called meeting medical necessity. So even if you really had, you come to see me, I can actually prove that you have like a diagnosis and you need treatment. If the insurance company does an evaluation on you, they can say, no, you don't meet medical necessity. We're not going to cover you for sites.
What does that do to the person who's anxious, neurologically diverse, and wanting to go to the ER for treatment, and they're told, well, you know, we have assessed that you don't need what your therapist says you need?
It happens all the time. To tell the audience, like I left my job at Fremont Hospital for 2 reasons. I got really sick, so I developed a medical condition, but I was so frustrated seeing all of these children that are cutting, self-harming, suicidal, and it was like they would
Kind of overwhelms you, anybody.
Well, the insurance companies at some point put a cap on, you know, how much therapy they can get, and they just throw them out. It's like, okay, you're not getting services anymore.
What does that do to you as a healer, Erin?
Well, it tells me that the system doesn't care. It's all based on like just greed.
Numbers.
And numbers, and it's like part of my frustration was like once those kids would be discharged, they would be in poor, like maybe really bad situations where they're not with the right therapist. You know, it's restricted on, you know, the insurance saying you have to be within network and all of this stuff. And then again, a lot of the clinicians wouldn't be able to accept the patients. So you see these kids going back into the hospital. They repeat the suicide all the time. And then it's a burden on the emergency doctors because they're getting all these psych patients in the ER.
And it overwhelms, right?
And they're like, well, this person was trying to commit suicide. You know, where were the mechanisms and the prevention and the tools in place to prevent that from happening? So they get flooded with that when they're supposed to be treating, you know, a car accident or,
Right.
you know, a real medical emergency. Like, and so my point is,
How do we change this system?
Yeah,
What do we do? That's Trevor.
Yeah,
am I wrong?
Well, it is. It's like we try and get doctors, and it's like, no, we're not accepting new patients. I'm like, well, we fit into every category that should be right at home, but they're just literally overwhelmed as a whole.
With that 600,000 people pass away from COVID.
Yeah. Geez.
That alone, the grief that turns to other emotions, anger, hostility, aggression, blaming, accusing, just hurting from what they feel is a complete lack of regard for at times. And here's the point, folks, and I think Erin and Trevor and I agree. We're not looking to blame people, we're looking to fix and solutioneer the system. I don't want to blame the healthcare. I don't want to talk to insurance people who are outraged that we mentioned this. Here's what I want to do. Let's help suffering.
Right.
Not left-wing suffering, not right-wing suffering. Suffering people.
Right.
Suffering people. That's what we need to address. And I don't want to blame the healthcare system. I don't want to blame insurance. I don't want to blame stacks of people at the tippy top who may be greedy. You're going to have to live with that.
Or maybe stuck in the system, even if they're not greedy.
Exactly right, sir. Yeah.
I mean, you think about 600,000 deaths was due to COVID. I mean, the average person knows 250 people.
Yes.
Right? How many close friends they have, who knows, right? But if you do the math on that, which I can't do because that requires math, that's an insane amount of people that are directly affected to just COVID deaths.
Exactly.
And have no place to go or are trying to get a therapy appointment with someone, but they can't.
Everything that Erin's talking about has impacted me.
Yeah.
I lost my brother this past year. who was, had comorbidity issues with a struggle with cancer, with chemo, and he passed away as he got flu. And then I have a son who's an ER doctor in New Orleans, and I mean, I love him, and I worry about he and his wife and the struggles they had when they were in New York at Brooklyn Hospital Center, because they both got COVID, and he went back to work 4 days after, and was right on the front lines as the chief resident, taking care of 1,000 dying people. And most young doctors don't ever see that level of lethality from a virus or a pandemic, and its impact on him, his wife, the structure, and now he's down in New Orleans. And as Erin said, he needs to focus on the trauma being brought to him from accidents and other things, and not trying to deal with the level of mental health issues that could overwhelm any system. Am I correct?
Yeah, well, that also leads to the second chapter, which is the impact that COVID-19 has had on our healthcare professionals.
Yeah, I was going to ask.
And an increase in it's a syndrome called compassion fatigue. And it actually got to the point where I know just with following COVID all last year, which was the hardest year of my life, to watch physicians commit suicide. Because they can't, the human body and just our minds can only take so much. And what COVID did to our healthcare professionals, we weren't prepared for it, and the numbers and just the compassion fatigue, that's led to their own mental illness.
Right.
And a lot of, substance abuse and just poor coping and the resiliency. So I'm a strong advocate for, advocating for my profession as well. We have to have our time to heal and take care of ourselves. And VR meditation has actually been known to really support that our healthcare professionals, especially with polyvagal complex trauma, because it's really taxing.
Tell us
Yeah,
what that means.
I was going to say, what is polyvagal complex? What?
She's like real smart, Trev. We're not like polyvagal. Sounds like it sounds like a car.
Yeah,
Go ahead.
So,
I'm sorry.
And this is a term that we use in the VA too, with combat veterans. Repeated stress on the body. There's this big old nerve in your body called the ventral vagus nerve. And if it's hijacked so much with, if you think of like being slammed by a car constantly,
Right.
something heavy.
Just once is bad enough, but
Yeah.
over and over.
Over and over,
But
yeah.
it's connected to a trauma. And so the frontline workers, just constant, just having, thousands and thousands of patients, and then having to keep everybody in incubators, like just the whole experience that has led to like a complex trauma and was linked to compassion fatigue. It's the same with the combat veteran. Anyway, the term means that your ventral vagus nerve has been hijacked and your body can't regulate. What complex polyvagal trauma is combining that with a comorbid issue, like say a health condition, like hypertension or cancer or something like that. Because if you think of the body, it's like, it's a system, right? It's like all of these complex, your nerves, everything. So that vagus nerve actually is connected to your prefrontal cortex and your hippocampus, your amygdala, and all of the chemicals that happen. If that nerve is like impacted through trauma combined with medical conditions, psychotherapy is known to actually help with regulating that nerve.
Alleviating the pressure.
And that's what Thera is doing. On the science part, this is the telemedicine,
Right.
but the science behind this is the biometric treatment. And we don't have it on the table here, but the Core Sense, which is a finger device, records the heart rate variability. And that's streamed through the VR. And that's how you're able, clinicians can see, well, what's going on with that patient? You know, their HRV is off the charts. They might be going into panic, or they're seeing something that's a trigger, or they're talking about something that's a trigger, or a phobia or something like that. So that's the science behind it. And with psychotherapy and the interventions that we use to treat trauma, this is a unique experience, and it's evidence-based. Dr. Skip Rizzo, who's on our board of directors, created the first treatment for treating PTSD
At USC, right?
at USC. And he's my mentor and inspiration behind what I created. But Brave Mind has a 90% efficacy to cure it without Zoloft, without Paxil, which is what they give the vets as soon as they're admitted into the VA.
So we're getting close to actually running out of time already on our whatever you call this podcast, We Are the Remedy. So let's talk about right now. I mean, the vast useness of Thera VR, I mean, is really unending, right? I mean, the purposes, the global reach, the instant, I don't want to say instant gratification because it's not, but being able to you know, part of those Zoom meetings is right because you can just jump on and have a meeting, and you don't have to travel. You don't have to, you know, do all this. So the access allowing people to jump on therapy online in virtual reality, I mean, it's really, it's there's no end to it. So, but let's get back to right now where your focus is with the Thera VR and in the children's hospitals, and let's talk a little bit about that.
Yeah, so actually the first critical steps are our clinical trials. So we were approved by the IRB to conduct a clinical trial to build the first platform to treat young adults that we're creating acceptance commitment therapy in VR, and that's an evidence-based treatment. So that is being conducted at the University of Laverne in Southern California, and myself and Dr. Nicole Mayer are co-writing that research. That's an RCT. And so those outcomes and that data will be used to monetize Thera VR to children's hospitals. So that's the children's hospitals that we're focusing on right now are Johns Hopkins in Baltimore, which has a serious deficit of tools that they can use with the kids that are in the ER, and there's not enough beds for them. And they're traumatized. And so what we're going to do is do a pilot first to have this in the hands of the child, and then the on-site social workers can be using telemedicine on-site to treat them. And the other children's hospitals are National Children's Hospital in Washington, D.C. And then we have, for adult populations, Ochsner Health in Louisiana. So our next steps that are critical are the clinical trials for publishing our research, and then also to implement into these really key pediatric hospitals that are focused on innovation or accept innovation.
So clinical trials are first, and that's, I mean, you've already got acceptance into those, and now what's needed? Like, we haven't really done the We Are the Remedy where there's an ask before, but I feel like today,
we should.
There's an ask. So what is needed to make those clinical trials happen right now?
Well, funding, because it's a lot of mobilization.
And how much funding?
So
right now?
we put together a budget, and this includes our developers as well. It would take $50,000 to fund the actual trial and to see it into fruition, which would be published in September. So the good news is that the product's been built, but we still have to pay for the focus groups, and we have the headset technology, but the cost of the trials, you're paying for other things like the accounts and the engineering accounts, and because there's a whole system that's you need to pay for to run this, right? So that's the clinical trials. It would take about $50K to actually fund that, and that over the course of the summer, we would have those resources to publish it.
And how many people will be going through the clinical trials?
So we estimate the numbers we have 15 clinicians that have signed up to do the testing, and then if we can get at least 20 patients for each clinician, that's our goal.
Right.
And it could be more because it's a volunteer process, right? And then you have to we call it qualifying for VR, because not everybody can use VR, but it's going to be early college students. So these would be freshmen. And,
18, 19.
And that's why during the summer it would be perfect, because they're not in school.
And we'll be learning from them. The research will be coming from them.
And the other thing is the students that helped with, we helped these students do a project at the University of Laverne to do a computer science project, which is they helped with building some of the code for the HRV. And this would create a job for them for the summer as well, so that they would actually have, and that's a goal of mine as well as an entrepreneur and a startup founder, is I want to create jobs for people.
Right.
You know, this isn't just like the innovation. I think that a lot of young people can learn about the innovation and focus on treating mental illness, but the clinical trials, that's like the budget, and then on top of that, we can start selling Thera now. There's a platform, the general platform that you guys saw.
Right.
That's ready to go to market now.
So could a therapist engage in it? They could sign up if I was a therapist?
Yeah, I
could be like, hey, I want one, and I want to start getting my clients on these, and... Yeah,
and actually, because I use it myself on my caseload.
Oh, okay.
So I'll give you an example. I actually treat a 10-year-old who's been homeschooled, Zoom conferencing. I guess it's like 6 hours of screen time.
Yeah.
And when she has therapy with me, she's excited.
Yes.
Right.
She's excited. As soon as she puts the headset on before I do the Zoom.
So was our 9-year-old. He was.
Yeah.
But this is what's critical when because it's hard to tell the audience if you haven't experienced it. This is a really critical thing that I've discovered as a scientist. This child actually created what's called mirror neurons with me. That's the contact that you have with your eyes when you and I are looking into each other's face. She did that with me as soon as she started using it in avatar form. No one else except a child does that, and I'll tell you why.
Interesting.
Wow.
I'll tell you why. It's because they've grown up with so much technology that their focus and concentration, it's very adaptable. With adults, it's a little different. It takes a while for them to actually, be immersed in it.
Right.
But with her, and it was really breakthrough for me, because I was like, gosh, she's looking at me like I'm a real person.
Right.
Like and we're actually building what's called the therapeutic alliance, like trust, mirror neurons, everything. Wow. And she's a trauma case, and she basically would just like stare into me like I'm a real person. And what's also unique, which I love sharing, is she wants me to be a teddy bear. Because it makes her feel comfortable.
Right.
And this is the other thing that you can't do in real life.
Right.
She hugs me.
Yeah.
She actually says, "Give me a hug," and and then you can't do that in a real office. There's no touching. But in VR, there's a safety component, right? And the nice thing about it is, and this was the whole concept that I designed. Let's make the innovation nurturing, make it humanizing, and through this, you can teach a person, like say a kid that has oppositional defiance or is extremely violent.
Neurodiverse kids.
Like look at all these kids that are like shooting.
Yes.
Yeah.
Through this, I believe that I could actually teach compassion, how to actually develop empathy through this, through the avatar technology, and then combining that with all the science. But really, the Thera VR it's a clinician driven, and my goal is to actually train clinicians to learn how to be a VR clinician.
Right.
And they're already starting this at Cedars. They're actually creating
Like Cedars Marin here, or
Cedars-Sinai in Los Angeles.
Oh, okay.
So my friends, Dr. Brennan Spiegel and Dr. Brandon Burkhead and Dr. Omar Liran, I hope I said his name properly, I spoke on the virtual medicine panel back in March, and they are the first research hospital that is actually creating a program to teach doctors, nurses, healthcare professionals to be VR clinicians. Wow. So if you're an investor out there, if you think that this is actually happening, this is actually coming into fruition, my prediction is 10 years from now, this is going to be just like an iPhone. You're gonna have this in your house, and it's
hopefully easier to use than an iPhone.
Yeah.
And the thing is, this is just an Oculus.
Yeah.
But for children, we use Pico Technologies, which is a far better headset.
Right.
It's in terms of patient safety, and that's another critical thing, like for people to remember, is that I'm all about patient safety.
Right.
I was just as skeptical about VR 2016 when I first saw it, but now everything that I've focused on is on compliance, making sure that it's safe. I've actually written protocols, education programs on how to be a VR clinician, but also combining that with safety. But my case studies right now, just with my own patient population, especially working with children, it's profoundly incredible, and I don't get to share that with anybody, but
we just did. We just had our guy, and I mean our guy who was with me when I was on, I was just as enthralled, and he said I'm stimulated. But here's the thing. Ismail was great.
Azrael.
Yeah. So let me just say this, and
we got to wrap it up.
Yeah,
too, so.
I'm there, and I can help us in just a minute. When I was, right after the passage of my friend Robin Williams, Erin and Sergeant Bird and I were in Yountville, and he had done an incredible voiceover for us to help the young men up there. And then later, one of the young people that was there in our system took the lives of 3 clinicians, social workers. And I would say, there's the angels ringing the bells.
Right.
If you know that if we can get help to people through this kind of therapy, there are young women and young men coming back from the trauma of war, young people who have adverse childhood traumas that we can help, neurodiverse children who have dyslexia, ADD, like me, who can be helped by this. What Erin's doing and her heart and spirit are into is educating our public to understand and understand the importance of this new technology. This, folks, and this woman are medicine for a better world, and for sure a better health care system that can stop it from being overwhelmed. And Trevor, I'm sure you feel the same way. I mean, any other questions for Erin?
My last thought is, you're going into you're going to do the clinical trials. I can't imagine that they won't be a success in any. I mean, they're going to be widely successful. And then the last thing out there is to say, what would you say the one sentence to someone that is a skeptic, like you were in the beginning, about virtual reality therapy,
and why it's important to invest in it and get behind it to help it.
Right.
Well, what I would tell a skeptic is look at the numbers. Like, the 2.5 million in sales of VR to just the consumer base, like home use, but also look at the numbers in the percentage of usage as a medical tool in the hospitals. So like it's this, and Thera is the first telemedicine tool for actual direct psychotherapy. And to add to that, my company is partnering with 911 telemedicine, and we're spearheading selling both technologies together, because you need to have the emergency protocols in place when you are using telemedicine. And so it's a preventative tool. So anybody that's skeptical, I would challenge them saying, well, tell me why there's 50% increase in teenage suicide alone.
Right.
Do you think the system's actually working?
Right.
Right.
So then, one sentence about Thera VR and how it's the wave of the future and why. Well, I think we know the why now.
Yeah,
but
for sure.
I believe
your
that
message.
I believe that Thera VR is an advent, the next chapter of telemedicine for psych care, and that combining this with the proper biometrics and also working with the existing telemedicine entities like 911 telemedicine, that will see better patient outcomes, reduced visits to the ER, a reduction in many different pathologies like violence and shootings, because it's a platform about connection. It's a platform that you don't feel alone. Right. Because the biggest problem right now, and we're going into the new part of COVID, which is called long COVID. America needs to wake up and know that there's going to be a whole new plethora of mental illness that we are not prepared for. And we need to take the steps to actually catch and monitor this, not just through our research hospitals, but to see these patterns. We have to improve the healthcare system. Yeah. We have to, and we can do that through innovation.
Yeah. And
this is a brilliant, folks.
Yeah.
This is a brilliant woman. Awesome. This is a brilliant healer. Stop. Mm-hmm. This is a woman I have worked with, and I've watched her heart, her compassion, her love, her connection. This is remarkable stuff. Think of this. You have a lonely person, and I've worked in hospice for a long time. A lonely person in a hospice who can make connection with a therapist on VR and get help and not feel lonely. I don't know what you would pay for your aunt, your cousin, your grandma, your sister to go on through the process of transitioning. But this is remarkably encouraging medicine, telemedicine, that can help us all. And I thank you, Erin, for coming on the show.
Thank you so
and
much,
I thank you for your advocacy and your completely driven nature. I made her put up a sticker on her mirror that says, "I am driven, but I am the driver." And so this is who she is and why she's important to Trevor and I, and we are the remedy.
Yeah, well, thank you again, Erin, and I think I'm going to go, find my new reality, because, I could use some help, that's for sure.
I want to actually share my gratitude to Michael Pritchard. If there was...
Don't worry.
The spiritual healing. Sorry, it's
okay.
It's okay.
There's not many people in the world that are like Michael, that put everything, no money, just being a true empath, that can do these shows in front of children, anti-bullying, and I'm so grateful.
Thank you. Yeah. Thank you, sweetie.
Well, I think that's it today on We Are All the Remedy. And, remember to go out there, share some stories, share some smiles, share a hug virtually or in real. And, let's all go out there and like Mike says, be the medicine for a better world. So thank you again, Erin.
Thank you.
That was great, John.
And have a good day.